Hey there, community. Do you know that if you are hospitalized with COVID or something else for that matter, and you are unable to tell the doctors what you want to happen, your loved ones are not able to speak up for you. You think that they are, and you assume that they can, but they legally are not allowed to speak up for you unless you have certain legal documents in place. And I cannot stress this enough. If there was ever a time to not just think about this, but to actually get off our butts and do something about it, now's the time, folks. Now is the time. My name is Sotera Anderson, and I protect families and their legacies by helping them plan for the unexpected. I am your personal legacy lawyer. As the COVID-19 pandemic continues to ravage the country, doctors across the nation are joining with lawyers in urging Americans to create the proper estate planning documents so medical providers can better coordinate your care should you become hospitalized with the virus or anything else. The most critical planning tools for this purpose are a medical power of attorney and a living will. These advanced healthcare directives work together to help describe your wishes for medical treatment and end-of-life care in the event that you're unable to express your own wishes. Adults over the age of 18 should put these documents in place as soon as possible. And if you are over age 60 or you have a chronic underlying health condition, the need is particularly urgent. Even those who already have created these documents, they should revisit them to ensure that they're up to date and address some specific scenarios related to the coronavirus, which we're going to talk about, excuse me, in this video. So first, why you need these documents. A medical power of attorney is an advanced directive that allows you to name a person, your agent, to make healthcare decisions for you if you're incapacitated and unable to make those decisions yourself. For example, if you are hospitalized with COVID and need to be placed in a medically induced coma, this person would have the legal authority to advise your doctors about your medical care. If you become incapacitated without a medical power of attorney, physicians will generally look to someone in your family to make these decisions for you, if they can legally. If no family can be located, they may have to go to the court and have the court appoint a legal guardian to be the decision maker. And in that case, that person is given the responsibility, a power, and it could be somebody that you would never want to make a life and death situation or decision over you. They will have that authority, and that's why this is so important. So while a medical power of attorney names who can make healthcare decisions in the event of your incapacity, a living will explains how your care should be handled, particularly at the end of life. So for example, if you should become seriously ill and you're unable to manage your own treatment, a living will can guide your agent to make these medical decisions on your behalf. These decisions could include if and when you want life support removed, whether you want hydration and nutrition, and even what kind of food you want and who can visit you, whether you want intubation. So to ensure that your medical treatment is handled exactly the way that you want and prevent your family from undergoing needless stress and conflict during what is already going to be a trying time, it's vital that you document your wishes in a living will. If you already have these documents, please keep them updated. Now is the perfect time to review the documents to make sure that they still match your wishes and your circumstances. For instance, if the agent named in your medical power of attorney is still the individual that you want to make those decisions. Has your health changed in ways that might affect your will's instruction, your living will's instructions? Are your values and wishes regarding your end of life still the same? And please do not do it yourself. You will find a wide selection of generic advanced directives online, but please do not trust these do-it-yourself forms to adequately address life and death critical decisions. This is especially true during an ongoing pandemic when doctors are constantly tasked with making highly difficult and uncertain decisions for patients suffering from this deadly new virus. When it comes to your medical treatment and end of life care, you have unique needs and wishes that just cannot be anticipated by fill-in-the-blank documents. So to ensure that your directives are specifically tailored to suit your unique situation, you must work with an experienced planning professional to create them, or to at least review them with you, both your medical power of attorney and your living will. Now, whether you are creating new documents or you are updating your old ones, you should keep COVID-19 in mind. This highly contagious and sometimes life-threatening nature of the virus is something medical providers have never dealt with before, and some months it has strained our nation's healthcare system almost to breaking point. There are a few unique circumstances that you need to be aware of when drafting these documents to make sure that all of the potential scenarios related to the coronavirus and its treatment have been properly addressed. So, number one, open lines of communication. Because COVID-19 is so contagious, family members of those who've contracted the virus are often not allowed to visit them in the hospital. So this means that your agent likely won't be there in person to make your treatment decisions. So while most advanced directives give your agent broad authority to communicate with your medical providers, the documents may not explicitly authorize certain type of remote communication. So to remedy this, you may want to consider adding language to your directives expressly authorizing your agent to give directions to your medical providers by phone, Zoom, email, Skype, FaceTime, other methods. So to facilitate this communication, you should bring copies of your directives with you to the hospital to give to your doctors and to your agent or your alternate agents, and to make sure that they have updated copies on hand when they need them. 2, permission to undergo experimental medical treatments. Since the vaccine is new and controversial and there is no effective treatment for COVID-19, you might consider adding provisions to your directives authorizing your agent to consent to or withhold consent to any experimental treatments or procedures that might be developed. Number 3, express your wishes about intubation and ventilators. So in severe COVID-19 cases, patients often require intubation, which involves putting you in a medically induced coma and inserting a tube into your windpipe, allowing oxygen to be pumped directly to your lungs using a ventilator. Some directives specifically prohibit intubation and ventilators, since those kind of measures are often a last resort and used primarily for like life support purposes. So some people's greatest fear is being hooked up to a machine just to keep them alive. But that said, some coronavirus patients have successfully recovered after being on a ventilator. So you might not want a blanket prohibition on intubation in all cases. So something to think about. 4, make sure everyone knows about and has current copies of your directives. So even if you have the most well thought out and professionally prepared directive around, they won't be worth the paper they're printed on if nobody knows about them. Both medical power of attorney and living wills go into effect the second you sign them. So you should immediately deliver copies to your agents, your alternate agents, your primary care physician, and any other medical specialists that you are seeing. And don't forget to give those folks new versions whenever you update the documents, and have them tear up the old documents. This is a standard part of our practice when we serve our clients. So when you work with us on your legal documents, we will make sure that everyone who needs to have your documents always has the latest version. So pandemic planning is what I like to call it. The tragic reality of the pandemic is that far too Americans are at risk of becoming seriously ill or even dying from COVID-19. So in light of that, it's vital that you and your loved ones take all possible precautions to not only mitigate your chances of catching the virus, but also having the best possible chance of surviving if you should become infected. If you are hospitalized with COVID-19, having updated advanced directives in place can make the medical decision-making process for both your healthcare providers and your family much safer and much easier, while helping ensure that your treatment is carried out based on your own personal wishes and values. So whether you have yet to create these documents or need yours updated to address COVID-19, I encourage you to meet with me as your personal legacy lawyer right away to take care of this urgent pandemic planning task. I can guide you to help make informed, educated, and empowered choices to protect yourself and the ones that you love the most. See you soon.